Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Speckle report. This audio podcast is part of a Heighe Bedlam. This audio podcast as part of a Bedlam Plexar. This audio podcast as part of a Storm Robotics production. In this audio podcast as part of this peer-reviewed published works from 2021. A little bit around structural and cultural isolation and around the structural and cultural isolation aspects. So the clear hierarchy of occupations established through the growth of hospital medicine is attributed as a major contributor to the commissioning of healthcare services. And there is a structural and cultural isolation of healthcare workforce, owing to the dominance by medicine. International experiences in planning and funding care for patients or healthcare services confirms that different approaches need to be investigated within the National Health Service or NHS. AHP and allied health professionals and patient and public involvement or PPI at primary care level has not been stratified. Clinical care groups focus on sort of making small but marginal service changes for which of the effort involved does not always appear proportionate to improvements in services, with a focus on healthcare healthcare service with a focus on around healthcare service provision, but also interlinked with patient-reported outcome measures. Services for patients with long-standing conditions, with long-standing illnesses, are not easily commodified. For example, within a purchaser-provider market. The services are provided, healthcare services are provided over months and years by a range of organizations and professionals, and it is hard to split them. It can be hard to split them into singular categories. A nephrologist or a specialist can open a healthcare service users electronic patient record and view important clinical details, important clinical details. So, for example, comorbidities, clinical history, previous communications from varying specialists, reports on previous imaging or radiological investigations, and a sort of chronological display of selected numerical data. Looking at sort of laboratory sort of investigations. For example, a decision is then made as to whether a healthcare service user should undergo tests or investigations or interventions in around primary care, or be referred to secondary care, or referred to secondary care. General practitioners use criteria sort of agreed in local guidelines to request advice or question the requirement or the need for hospital clinical reviews. CKD, in around CKD, for example, and consequently, sort of telephone calls and referral letters are sort of the principal, or have been the principal sort of and principal basis of communications between healthcare sectors. The processes are often inadequate, resulting in miscommunication and insufficient healthcare provision. That draws this audio podcast to a close. This audio podcast is part of a Speckle report. This audio podcast as part of a Heighe Bedlam. This audio podcast as part of a Bedlam Plexar. And this audio podcast as part of a Storm Robotics production.